I'm not going to make any organist comments, so we'll move on quickly, shall we, to the report on the annual report and accounts from Karen.
Yes, not much to say. Generally, the annual report was published and laid before Parliament on 21st of July, and I hope people have the opportunity to read it. I do want to thank everybody who contributed to it. That it's very much a whole organisation exercise, and I think it's a good reflection of the work that we've been doing over the last year. This will be presented to our AGM in October as well. I did just want to highlight one thing that was reported in the annual report, which relates to a serious incident which we were alerted to at the end of March by one of our contracted suppliers at the time, SBS, Shared Business Services, who raised with us an issue that they had identified of a large volume of correspondence which hadn't been processed. This correspondence generally is from, for example, providers who are sending correspondence to a GP, but it goes to the wrong GP, or that GP doesn't have the relevant patient, and therefore it needs to get forwarded to the right GP. So this volume of correspondence, which had grown up over become a backlog over a period of years, had grown up into a very large number and was reported to us at the end of March. We immediately established a national incident team to handle this incident and to process and review and handle the correspondence, and to ensure that any aspects that might affect patients are being followed up. And that work continues, but letters have been written out to any GP practice and every GP practice where there has been identified a potential risk to patients, and we're in the process of following that up. Those numbers are relatively contained. The thing I wanted to bring to the attention of the board really was the fact that we are not yet happy with the information and the assurance that we have from SBS about how this incident arose and the potential extent of the correspondence that might be at issue. So we will obviously be taking this up very strongly with the Department of Health, who sponsor this organisation, as well as with SBS itself. But I just wanted to ensure that everyone was cited on that issue.
Well, thank you, Karen. Do you wish to add anything?
No, I think David will say the audit committee has also, under Karen's direction, reviewed this, and I think the NHS England incident team that Karen has stood up has pulling out all the stops to sort through this situation. But to be blunt about it, the information available to us is that the response from SBS has been unsatisfactory and obfuscatory, and we intend to formally bring that to the attention of the Department of Health as the co-shareholder in SBS.
Audit committees all over it, and clearly looking not just at managing the incident, but also on what's the lessons learned, and how can we make sure that our processes are in place to an information base to get ahead of these things as well.
Yeah. Might be worth me just clarifying the service that this relates to is not a service that we carry out anymore. We decided that it wasn't an appropriate service for us to provide. So indeed, when such correspondence is surfaced, it is now sent back to the original provider so that they can update their records and send it to the right GP surgery. So that service has been closed down as part of the process.
And these were a whole set of arrangements that NHS England inherited on its inception. These were not agreements that were ever negotiated by NHS England itself.
Indeed, these stem from contracts that predated NHS England from PCT days and is a legacy of those arrangements. And in fact, the arrangements that we've been putting in place around the primary care support services contract is what has surfaced this issue. So I think we can be confident and assured that this type of activity is not going to arise in the contract that we currently operate.
Maybe, Mark, it's also worth just Karen saying a sentence then too about the work that you've got to ensure that the transition of these arrangements from SBS, we're holding the new contractors' feet to the fire as well, given the initial teething issues that arose there from the GP's point of view.
Yes, very, very definitely. So, as I say, on this particular service about handling of GP correspondence, that was closed down. As the board knows, we have been working to procure a new owner for managing the service around primary care support services, and successfully transitioned that services to Capita. And for the first 6 months of the contract, that service ran very successfully. But at the point in March when some very significant transformations were happening, very worthwhile and positive transformations intended to improve the services, and I think were going to be welcomed by our stakeholders, GP practices and other primary care contractors. But we've hit some problems associated with the implementation of those transformation changes, and as a result there have been significant issues which have affected stakeholders, GP surgeries and other primary care contractors. That's been hugely unwelcome and very obviously something that we're very disappointed with, both ourselves as managing the Capita contractor, but also Capita themselves are hugely disappointed. We're working extremely hard to recover those service issues, and have been talking to the BMA and GPC and stakeholders constantly through this process. I am confident that the service is in recovery, and by even now many of the backlogs that did grow up in the early months have been recovered and eliminated, and service is improving all the time. There is more work though to be done around that, and I am working very closely with Capita to make sure that that gets delivered as quickly as possible and we produce the service that our stakeholders and contractors have a right to expect.
Okay, thank you very much, Karen. I think that point about Capita reinforces the point that David's made about our need to get on top of managing third-party contracts in this space. I think so far as the SBS experience is concerned, the critical thing to note is that this isn't just bureaucratic paper moving in the back office. There are instances which may have real implications for patients, and it would be foolhardy for us not to take this immensely seriously and to take the steps that the Chief Executive has proposed. Thank you very much for that report. Maybe then move on to the next item, which is the NHS Customer Contact and Complaints Annual Report.
Yes, this is an annual report of the performance against handling contacts and complaints, and this report is slightly different this year, so I'll go into the details of it. But there is some positive news here in terms of the positive improvements that have been made to the service that we provide, and the complaints that we're talking about and contacts. The contacts and general inquiries come from many different sources. The complaints are specifically associated with primary care service, and that is probably where the complexity of the work is. We have very good service and responsiveness in terms of just handling contacts and responding to them, and we've implemented some positive changes associated with a new system and a quality framework. And through the work of implementing our quality framework and working with our regional teams, who are the teams who manage the complaints, we identified during the course of the year that there was inconsistency in how complaints were being what was being called a complaint and being logged as a complaint. And I think it was very useful that we surfaced this quite early, because what we discovered was that some things were being categorised as complaints which were not really valid complaints on the basis that they weren't something that we could investigate, and indeed the patient who raised those complaints or issues did not want us to investigate those issues, but simply to record a concern. So we have recategorised a number of these issues as concerns, and the number, therefore, of formal complaints that we can actually investigate and resolve for the patient who raised them. We've got much greater clarity, that is good. We've got much better handle on what is going on in our service and our primary care service, that is good. The number of actual complaints is much smaller than we were reporting last year. But because those complaints are complex, and what we've actually done is stripped away from the reporting, you'll see that because the numbers of concerns that are being addressed, which are the less serious issues, and have got quite good resolution of those 70% within the target time for resolution. But the complaints which take longer and are more complex are ones where we only have at the moment 46% success rate in resolving those within a 40-day period, which is our target. Now, there are a number of reasons for that which we are getting under. We have certainly had issues in our regional teams associated with staffing and contractor support associated with these services. These are also much more complex, and I think it's probably worth noting in the report that our customer satisfaction associated with not only the resolution of complaints, but also the time to resolve those complaints is quite positive. It's 71% at the end of the year. And so I think the most important thing for patients who raise those complaints is that they get a satisfactory resolution to the complaint. So we're doing a piece of work in the autumn to review not only that service, the processes that we're going through to manage those complaints, and whether we have the right degree of resources, and indeed whether it is appropriate to what is the right target for us to set ourselves, so that we can make sure that we are hitting that target. And if the current target is the right target, we will continue with that and see what we need to do to improve it. But if that seems too ambitious given the complexity and the scale of those complaints, then we may come back to the board and consider a rebaselining of what that target is. So that's a little bit more complicated than normal. I hope it will be. Now we've got a good baseline, good data, and a better handle on what is going on. I'm confident that we'll be able to give you a much simpler story in the future, and what we would hope to do is probably consolidate this report with our annual report so that it just becomes part of our annual reporting process.
Well, thank you. Thank you for bringing it separately to our attention on this occasion. Are there any queries, comments to Karen on that? No. Thank you, Karen, very much. And it's been obviously a sort of thermometer by which we can gauge our performance, so critically important that we track it closely.
Absolutely.
Thanks very much. We're now going to turn to the next section of the agenda, which is around governance. And the first paper on this is the Governance Manual Approvals.
I don't think we want to spend a huge amount of time on this, but the
Maybe the understatement of the day.
good.
Right, then we
This
may
is a
move on.
piece of consolidation of many
Yes.
pieces of governance work that we're trying to manage more effectively. We've been through this in a lot of detail with our Audit and Risk Committee, so
I don't
just
think we
want to give
should.
you a
I don't
full
think we should
approval.
repeat the work of the Audit and Risk Assurance Committee.
No, it's recommended.
Okay, so may we just take that?